Dr. Sandipan Sabde sir, and Dr. Sancheti Suryavanshi ma'am. On stage, the speaker is Dr. Amit Tagare sir.
Start. Good afternoon, everyone. I thank the team Mahapedicon 2025 for giving me opportunity to talk about novel bubble CPAP unit. This is the disclaimer. I have no financial obligation from any industry partner or the equipment related to it. This is purely academic and scientific session. So we all know the physiological actions of CPAP. It establishes and maintains the FRC. It keeps the lung open, decreases the upper airway resistance, decreases the collapsibility of upper airway. It inflates the collapsed alveoli and progressive alveolar recruitment is achieved, reduces the intrapulmonary shunting, promotes the release and conservation of surfactant, increases the lung growth and regularizes breathing system. Now, 15 years back, when I was doing my neonatology in KEM, we had published this study. We had two studies on the same. First was the pilot, and then was a big trial of 144 patients. And we showed that bubble CPAP is more successful compared to ventilator CPAP. Severe RDS had more failure in CPAP in those days, which have changed quite a lot in nowadays, in newer times, and it reduces the need of surfactant. It has been proven that almost 50% reduction in surfactant need if we use judiciously CPAP. Now this is the bubble CPAP system. Now this is the source. From this source it comes to the humidifier. From humidifier it goes to the neonate, and this is the inspiratory limb, and then it goes to the expiratory system, and this is the bubble CPAP generator. And so the components are gas source, we need a compressed air and central oxygen. Humidification is a necessary part of any type of ventilation. CPAP circuit, nasal interface, and CPAP generator. Now there are lots of studies and comparisons about the CPAP interfaces. Today we will be talking about the core of CPAP, that is CPAP generator. So how does the bubble CPAP actually works? We need a spontaneously breathing baby who is breathing against the pressure created by the underwater expiratory limb. Now in this thing we can see this is the underwater expiratory limb. Water chamber, the underwater expiratory limb, and bubbling created by expiration is the heart of bubble CPAP. So we have to keep watch on the bubble CPAP generator and see the water level is intact and the tube is effectively at the level that we want to give CPAP. Now what can be novel in bubble CPAP? Now Their novelty can be there is no need of any electric supply like the Vayu CPAP, or the novelty can be in the modification of bubble CPAP generator, which has been going on for last 10-15 years. Now conventional CPAP generator has 450 ml of water content. Expiratory tube is 10 millimeter or less. Delivered tidal volume is very low, and measured frequency ranges from 20 to 40 hertz depending on the size of the expiratory tube. Now if we compare, it is just like a high frequency ventilator. It's very close to high frequency ventilator. Mechanism of bubble CPAP generator. CPAP, the expiratory tube which is immersed under water creates bubbling in the CPAP generating bottle, and the noise in the bubble is transferred to the lung, which helps for better gas exchange. If bubbling is increased, it increases the noise. This increase in the noise can be helpful in better gas exchange, and this is because of the stochastic resonance. Now this stochastic resonance will increase the amplitude. Now we are all familiar with amplitude in high frequency ventilator. Now what is the physics behind this? Natural frequency, resonance, amplitude, and stochastic resonance. Now we all are aware of those old time wall clocks where the pendulum keeps on moving, and we have been taught in our physics also. Now when an external periodic force is applied to the natural frequency, then what is created is called resonance. The energy is absorbed and that is transmitted to the moving substance. Now amplitude is the power applied to a system due to which its traveling distance increases. So it is just like swing. I am sitting on swing and I am taking the swing, and somebody pushes me, and then my movement increases. So that becomes my amplitude. So this is the amplitude, the highest point to lowest point. Stochastic resonance is when we add in that amplitude. Now is it important? This was a study done almost 20 years back, where they showed that if we increase the bias flow from 6 to 10 liters or 12 liters, then the amplitude can increase. The only problem was there is a limit to increase and oxygen is wasted. Now can we increase gas flow? We can increase gas flow by increasing bubbling, but the safe limit is up to 10 liters. Beyond 8 to 10 liters, there is risk of air leaks, and there is increased bubbling at the expiratory limb, which will add to the work of breathing. So what is the innovation? The water capacity is increased, the size of the expiratory limb is increased, the diameter, the introduction of extra flow, which is very novel thing. The extra flow bubble collides with the CPAP bubble and enhances the noise and amplitude, and there is no extra oxygen needed. So here is the bubble CPAP generator, and here is the extra flow, and this is creating a lot of noise, which is what we want. So here we will see in the conventional bubble CPAP we get only this, but here we get a delta P, which comes in high frequency. So how does it work? The introduction of controlled extra flow increases the amplitude and delta P, and we can independently control it. Increase in water quantity in CPAP generating bottle helps to reduce the frequency, and due to increase in the water quantity, the bubble formation is slower, bubble size is increased, and this helps in increasing delta P and reducing the frequency. So this is what is in the conventional bubble CPAP, very high frequency and very brief movement, and this is what happens here. Now can it be tried in real world? Now it is already being used. We had our own experience. We had initially 3-4 months there were a lot of modifications had to be done, and it were done by Shreeyash team, and finally then we had around 28 babies on bubble CPAP, partly on amplitude and some on conventional. They were all preterms with respiratory distress with good respiratory drive, because that is what need of CPAP. It was as per availability. This was not randomized. And from January to September this year, data was analyzed for comparison. So if we see this, they were all comparable. We had 13 patients in amplitude CPAP and 15 in the conventional bubble CPAP. Gestation wise, they were all similar. The only slight difference was on the antenatal steroid. We had more babies with poor antenatal steroid coverage in amplitude CPAP, and we had more outborn babies in amplitude CPAP. But outcome wise, one baby needed surfactant in amplitude CPAP. Apnea were 2 in both, and success, there was one baby failed in amplitude CPAP group. That was the same baby who needed surfactant, who had very severe disease. But statistically, it was comparable. So amplitude bubble CPAP is safe, it is effective. We need large multicentric trial to assess the better comparison. Now, assessing a non-randomized, where we have seen some sicker babies came into the one limb, and some better babies went to other limb. This can be, the bias can be avoided, and it should be compared with non-invasive ventilation. So that's what we want to do, because we have seen over the time the evidence is coming, non-invasive ventilation is superior to bubble CPAP. Because amplitude CPAP has an additional character, we want to try it in comparison with non-invasive ventilation. We can achieve incredible things by being committed to make them happen. So when we are in neonatology, we have to be committed and keep on pushing our limits and dedicate our work to betterment of patients. Thank you.
Hello.
Thank you, Amit. Thank you for wonderful talk. You nicely simplify the mechanics behind CPAP generator. So, thank you.
एफिशियन्सी वाढते तर त्याच यू सेट की जे पॉट आहे सीपॅपचं त्याच्यामध्ये पाणी जास्त राहिलं तर त्याची एफिशियन्सी वाढते तर जे
See, this is all about technical thing. In our conventional bubble CPAP generator, we can't put extra water, because then the moment you cross that upper line, then the CPAP pressure will increase. Here it was inherently increased, so the size of the generator was increased from 450 mils to 1 liter. So that comes as the part of machine. We can't modify it on ourselves. So if you are using one bubble CPAP unit now, you can't tomorrow go and put a bigger, because that may not work with that. So this is a complete different innovation, and the idea was very different. Here this unit wants to reduce the frequency, and at the same time it wants to add extra limb to increase the bubbling, so we can add stochastic resonance. So we have always tried of doing stochastic resonance by increasing the flow in the system. So here it is done externally. So you have a different thing. So we can't change in our own machine. So I have bubble CPAP machines. I won't be making a 1 liter generator for that machine, because that I don't know how it will change the mechanics of CPAP.
what about tubings, decreasing the diameter of the tubings and increasing the flow?
Decreasing the
diameter of the tubings, the tubing which go into that pot, and increasing the flow.
So that is all to reduce the frequency.
Increasing the flow, you said if increase the flow.
That flow is increasing the external tubing, not in the CPAP tubing.
No, that
See,
tubing which goes into that pot or bucket filled water. That tubing which goes into the pot that generates the PEEP.
There are two tubes in this machine.
Sorry to interrupt, but we are already running late. You can personally ask the questions if required.
Thank you.
I would like to thank you, sir, for such a valuable session. I request the dignitaries to move towards felicitation area. Nishita will escort you to the felicitation area. I request Sanjay